United States President Donald Trump has announced that he will set up a second coronavirus task force comprising of health practitioners and business people to advise on when to reopen the country's stalled economy. The advisory council is expected to include the Treasury Secretary Stephen Mnuchin and White House Senior Economic Advisor Larry Kudlow, among others. The news comes as the country faces crippling job losses, with close to 17 million people filing for unemployment benefits in just the last 3 weeks. Trump said that the names of the council members would be announced next Tuesday.
That's a very big decision. I don't know that I've had a bigger decision than that when you think, right? I would think. I mean, think of that decision. Somebody said it's totally up to the president. I saw this morning. It's totally up, and it is. I don't know that I've had a bigger decision, but I'm going to surround myself with the greatest minds, not only the greatest minds, but the greatest minds in numerous different businesses, including the business of politics and reason. And we're going to make a decision, and hopefully it's going to be the right decision. I will say this, I want to get it open as soon as we can.
Trump has also confirmed that they now expect the death toll from the COVID-19 outbreak to be far lower than earlier estimates of above 100,000.
Minimum number was 100,000 lives, and I think we'll be substantially under that number. Hard to believe that if you had 60,000, you can never be happy, but that's a lot fewer than we were originally told and thinking. So they said between 100 and 220,000 lives on the minimum side, and then up to 2.2 million lives if we didn't do anything. But it showed a just tremendous resolve by the people of this country. So we'll see what it ends up being, but it looks like we're headed to a number substantially below the 100,000. That would be the low mark. And I hope that bears out.
Well, for more on this and other developments from the world's epicenter of the virus, we're now joined via Skype by our U.S. correspondent, Sherwin Bryce-Pease, who is in New York. A very good afternoon to you, Sherwin. Well, the U.S. are passing 2,000 mark of deaths in one day. Is it fair to ask, what is going wrong? We've heard Trump saying, we're having more tests than any other country, and that's why our numbers are so high. But how does he justify the deaths that are now being recorded? 2,000 in one day is beyond scary.
Well, there's no justification per se for the deaths flow. All you hear from this president is generally in his press briefings with that Corona Task Force daily is a pat on the back for what the federal government has been able to do in terms of expanding testing here. But the numbers do speak for themselves, particularly here in New York State, the epicenter of this virus, accounting for almost half of the almost 19,000 dead. This has been a real gut punch, not just to how societies function around the world or here in the United States, but certainly how the government is responding, how businesses are responding, and how individuals are responding here. And, in terms of justifications, there can only be justifications or recriminations during the period that will follow the arrest of this public health emergency. Remember, the focus now has to be not on pointing fingers, but very much on what the response is now, dealing with how to bend and flatten the curve, how to bring hospitalizations down. We're seeing initial indications that is beginning to happen. We're also seeing the number of ICU beds beginning to decrease, the number of hospitalizations, the number of ventilator intubations. But as you correctly point out, there's a bit of a contradiction in terms of this peak we are seeing in the number of dead. Over 2,000 just yesterday. It has been consistently over the last week above 1,000, 1,700, 1,900. So it really is a real gut punch for just how this country has operated. But in terms of justifications and post-mortems, that will come later.
Now, we hear, of course, that a second task force will then be used to advise the president. And in that press briefing, I actually heard one of the reporters quickly asking him, is this a second task force? And he was very quick to say, well, no, the previous task force did well, but I'm still going to introduce another task force. There seems to be a problem there. What exactly is happening? Why is he having to reintroduce another task force if the other task force had indeed done a good job? And we can say that the task force clearly hadn't done a good job because we are sitting with the numbers that we're currently sitting at in the US.
There is, Flo, I think, a showmanship element to these daily press briefings with President Donald Trump. He wants to come out. He might not be the expert, certainly from a public health emergency perspective, but he tends to dominate these briefings because who knows? I mean, he talks about the ratings that are, equivalent to Monday night sports here in the United States, big football games. The Bachelor, for example, is a very popular show on television here. He compares the ratings to these very popular shows. And really is at times a distraction from, the credible data that the public health emergencies, Dr. Fauci's and Dr. Birch's, that tend to be sort of his wingmen during these daily press briefings. So it's a very complicated time in America. It's not a very easy thing to explain, but the president does see himself basically being front and center here. He's called himself a wartime president, and he feels that this could benefit him in the long run. Given that this is an election year, he wants to be seen front and center. And this has always been a president that has recognized any publicity is good publicity. And I think to a large extent that is what we are now seeing from this president. But the numbers, as you correctly point out, do speak for themselves. And so it's a very complicated scenario for him to circle here in terms of what he's delivering during those briefings.
I mean, Sherwin, you talk about the fact that it is an election year, and I actually did want to go there. It does seem that Trump's poll numbers have dipped over his handling of the coronavirus pandemic. What generally were Trump supporters really saying? I mean, I'm looking at Twitter, and there are some Trump supporters still saying, look, Trump is doing the right thing. But of course, if you are in that way, sort of so in love with the president, you will say whatever they do is correct. But let's talk about people that are rationally sort of thinking about how this is all going. People that are looking at the mass graves that we are seeing all over, the news outlets, all over social media. What in reality are those people sort of saying about Trump's leadership at this time? And is it reflective of what we're seeing at the fact that, his numbers have dipped over his handling of the situation?
Well, his numbers initially went up, Flo. I mean, he had reached record numbers. As history tells us, when there's a crisis, be it the 9/11 crisis or the war against Iraq back in the day under George W. Bush, Americans tend to coalesce around their commander-in-chief during a period of crisis. And I think the president articulating himself that this was a war, that he was a wartime president. And so you saw his numbers tick up initially, but those numbers have now come down. In fact, the conservative-leaning Wall Street Journal just this week, their editorial board published an opinion piece about how this was actually hurting the government's response, these daily press briefings that the president tended to dominate, and really, at times going off topic, not just dealing with the coronavirus, but also on domestic politics, Bernie Sanders dropping out of the presidential nomination race for the Democratic ticket. A lot of divergence from the core reason why these press briefings are held. It's to educate the public and inform the public about the public health emergency that the United States is trying to arrest. And as you are showing right now, those pictures of mass graves being, dug up on Hart Island. This is an island just north of Manhattan, just north of the Bronx, where New York City has had to make this tough decision to bury unclaimed bodies that have not been claimed by loved ones or families. And so they're burying them in mass graves on this Hart Island. They're being buried there by prisoners from one of the jails in the city. And that really, I think these images really do speak, as much as you were showing all the death toll numbers from various European countries and here in the United States, those numbers don't really speak to the visuals you are seeing right now. Yeah. You'll remember also, Flo, that people are not being able to bury their loved ones right now. Morgues are overflowing with bodies. Hospitals have refrigerated trucks parked outside because there's just not enough space in hospitals and morgues to house these bodies. And that's why you are seeing images like this on your screen right now. The mayor of New York, Bill de Blasio, has made it clear, though, that if loved ones were to come forward, they would then hand those bodies. They will dig them up and hand them back to loved ones and families. But I think this just speaks to the volumes we are seeing here in terms of dead, and how even the biggest city like New York City is struggling to handle the number of dead that we are seeing around the country.
I mean, what I'm seeing here, Sherwin, the visuals from Hart Island that we are showing our viewers at this point, are just, I mean, I can't even find the words really to express the kind of emotions that I feel as a person seeing those visuals. But take us through, what the mood really is in New York, where you are, where we've been hearing these numbers. And as you say, it doesn't speak, the numbers don't speak to what we actually see. I mean, those visuals really do tell you what is actually happening, and really very scary for us here in South Africa as well. But as you're sort of doing your work, what are some of the things that are being said by people in New York and in particular about what they are seeing?
I was on a Zoom call yesterday with a colleague of mine. She's a 76-year-old colleague that works with us at the United Nations. She's a correspondent for the Associated Press, and I'm sure she won't mind me sharing the story. Flo, she told us that her sister is in a nursing home. Her older sister is in a nursing home in New York, and she shares a room in that nursing home with someone that had a temperature of 104 degrees, I believe the number was, and this person was then moved out of her room. And she said she was very, very concerned about the well-being of her sister. You will understand that, the first outbreak, where the epicenter was initially in Washington State, where a frail care facility was the hardest hits, over 30 dead in that facility. So there's a concern, certainly from families who are not even allowed to go and visit their loved ones in these facilities. You are not allowed to go and visit your loved ones in hospital when they are intubated or when they are being treated for COVID-19. You are not allowed to be there. You can stand outside the building, but you cannot go in. And she was explaining how she's constantly calling the staff to check on her sister's temperature, to make sure that there hasn't been a change in her condition. And you have to stay on top of the staff at these institutions, who themselves are overwhelmed by the number of checks and the greater responsibility that comes with caring for people, whether it be first frontline health responders in hospitals or caregivers in old age homes or in care facilities. So it's a great deal of anxiety that's associated with living in a place like this, especially when you have loved ones who have underlying conditions already. She was saying that her sister smoked for many years, so that's, with this being a respiratory virus, a great deal of concern for people in a situation like that.
Now, is there a sense that you get from people that you are speaking to that perhaps, especially those that are affected, that have family members who either are dying or have died, that they feel that perhaps the president is really sort of detached from reality of what they're experiencing and what they are seeing?
Well, I mean, it really does depend on whether you're a supporter for this president or not. I perhaps didn't answer your earlier question quite correctly in terms of, what's happened to Trump's support. Trump's support is still consistent. He has not dropped below 40%, and his support has sort of hovered between 40% or 39% and some 45%. It went as high as 49% at the beginning of this crisis, but it's back down to around 45%. So his support has been consistent. This president can do no wrong for the people that love him. And it's that other majority, the 51, 52% that have been consistently against this president. And of course, this is also geographically based. In New York City or in California, these are blue states. These are solidly Democratic states. So you're not going to find a lot of support for the president in a place like New York City, for example. And just the spiraling death toll and the numbers we are seeing in the city is not going to enamor the president to people in terms of voting for him this November. So his concern is basically shoring up his support where it exists already and being able to get just enough to beat the likely nominee, Joe Biden. But polls are suggesting, Flo, that President Trump has got an uphill battle here. And the numbers we are seeing, if you are the wartime president and the commander-in-chief during a wartime scenario, 18,000, 19,000 dead, over 500,000 cases, doesn't speak to an effort of glory, if you will. You cannot shower yourself in glory when numbers like that speak for themselves.
All right, Sherwin Bryce-Pease, as always, many thanks to you for that update. No doubt we'll continue to catch up with you there in New York. Please stay safe for us. That's Sherwin Bryce-Pease speaking to us from the US in New York.